If the vertebral column was built in only for strength, it would be rigid. But if it was meant only for movement, forgetting the strength part, we would be collapsing, right? So how does the vertebral column solve all this mystery? Let's figure out together. What's up, ladies and gentlemen? Welcome back to NeuroSketch with Dr. Kenny, where we usually solve complicated topics in anatomy and neuroanatomy. You need to subscribe for free to keep in touch. And today, let's talk about the back. So, vertebral column is also known as the backbone, and this is what actually places us in, subphylum vertebrate. We human, we belong in kingdom and Mariam, phylum Chordata because of the presence of the notochord, but in subphylum vertebrate because of the presence of the backbone. So we are not very different in terms of backbone with animals like dogs, dinosaurs, dragons, crocodile, and some other animals. Yeah, so this is the backbone. This is the backbone of the vertebral column. And the vertebral column is made up of individual bones which are known as the vertebra. Plural is vertebra. This is plural, this is singular. And the word vertebra is Latin word for something which can turn. It acts as a joint or something that can rotate. So this defines the rotation nature, the flexibility nature of the vertebral column. The vertebral column allows turning, twisting, bending, and rotational movement. This is to say the vertebral column is strong but flexible, This is why it maintains movement. It is a part of the exoskeleton together with bones like the bones of the skull, the ribs, and the sternum that we have already discussed. So in human, the vertebral column is made up of individual bones that we have said they are called the vertebra. But early in development, the vertebral column is made up of 33 bones, 33 individual bones, or 33 vertebra, and they're divided into 5 groups. So we have the vertebra which are falling under the neck region, and we call them the cervical vertebra because the word cervic means neck in Latin. So we have 7 cervical vertebra. They are denoted by letter C's. We have C1 through C7, and then under the region of the thorax, we have the vertebra also which are falling in the region of the thorax. We call this thoracic vertebra. So we have 12 thoracic vertebra denoted by letter T's. So we have T1 through T12 under the region of thorax. Downside here we have the vertebra which are falling under the abdomen, and we call them the lumbar vertebra, meaning loin. So lumbar vertebra, we have 5 lumbar vertebra denoted by letter L. We have L1 through L5. And then we have 5 sacral vertebra which are denoted by letter S. So we have S1 through S5. The sacral they are made up of they will later make a single bone which is vertebra, which is sacrum. Lastly, we have the coccyx here, which is made up of individual 4 coccygeal bones. So in total we have 33 vertebra early in development, but later in life the 5 sacral bones will fuse to form one bone, and also the coccygeal bones, the 4 coccygeal bones will fuse to form a single bone. So that when you do math, you find that in an adult you have 26 vertebra instead of 33. Why? Because 7 bone fused, 7 bones have gone away, remaining with 26 vertebra. So what is the structure of the vertebra? The vertebral column. When you take a look from anterior or posterior, you will see that the vertebral column, it is a straight line. It is like a straight line from anterior or posterior view. But if you take a side view, you will see the vertebral column is curved. It's curved. So simply, easy. Posterior, anterior, posterior is straight. So when it happens, like you see someone, when you take a look from posterior view, you see this vertebral column is curved. You know that is abnormal because it was supposed to be straight from our anterior or posterior view. So we have this condition which is known as scoliosis, and scoliosis is just lateral bending, the lateral curvature of the vertebral column, which was not supposed to be there. So it can be congenital. Someone can be born with it, or it sometimes happens during puberty due to some factors, not to mention the poor posture when you sitting with the poor posture. But if the baby is born with this scoliosis, he or she needs to be screened for some other diseases like the anelectomal malformation. So it coexists with other diseases like for congenital component of it. It exists with other diseases like anelectomal malformation, cardiac disease, tracheoesophageal fistula, renal, and some other limb deformities. So it can be neuromuscular or syndrome related, as we have said. Okay, so what have you said? When you take a look from posterior, it is curved. From the lateral view is curved. So it is curved. I got curvatures. So the big question is, why curvatures? Again, we said one. We haven't mentioned it, but one among the function of the vertebral column is to act as a shock absorber. And what did we say about the shock absorbing property of a bone? When a bone is curved, the curved bones, they have this shock absorbing ability compared to the straight bone. So these curvatures, they number one act as springs to absorb the shock while you're walking, while you're learning. So that we're going to discuss shortly the function of the vertebral column. But when you're walking and learning, to avoid the force to be transmitted to the brain, directed to the brain, so we have curvatures to act as a shock absorber to dissipate the mechanical stress. Okay, it also helps to balance an upright position. In what sense? When you're standing in an upright position, the line of gravity passes through the ear, the external auditor canal, on the cervical curvature, and then it skips the thoracic curvature. It passes on the lumbar curvature, and then the line of gravity also passes through the hip, and then just a little bit anterior to the knee joint and anterior to the ankle joint. So this way, the center of gravity is balanced, and it's balanced by having these curvatures. If the vertebral column was a straight line, it was a straight spine, means the center of gravity would pass anteriorly, and so we would be falling easily forward. We'll be falling forward easily. Okay? Or otherwise, you would be using a significant amount of energy for the back muscles to maintain the upright position. Why? Because the center of gravity was passing anteriorly, and so we would be falling easily. That is a little bit of biomechanics on how it helps you on upright position. But the curvatures, they increase the strength, and they protect the vertebra from fracture. If it was a straight line, the shock would be transmitted easily. It would be transmitted easily, and the fracture of the vertebra would be easy. It would be easy. So what have we said in terms of the lateral view? So from the sides, it is curved. So what are these curvatures? What are these curvatures of the vertebral column? So when the baby is early in life, we only have one curvature, which, as you can see, is a concave anterior. It is a concave anterior one curvature early in life. But when the baby starts to hold its neck at around 4-3 months, the cervical part of the vertebra curves backward so as to hold the head. So as to hold the head. So we have the cervical, the cervical region would be convex anteriorly, and then later also about 6 to 9 months, when the baby starts to sit and stand and walk, so the lumbar region also curves anteriorly so as to form the convex curvature, so as to hold the trunk back, to support the trunk back. See here, it is curved here. It was initially a concave anteriorly, and you can see the shape of the baby. Okay, but when the baby starts to hold its neck, so the cervical part should bend a little bit posteriorly to form a convex shape here. Same applies here. When the baby starts to stand, to sit still and stand, the lumbar part should also curve so as to support the trunk. so it's curving backward to support the trunk. So guys, you can see also that we had only one curvature, which later developed, two curvatures, new curvatures were formed. So you're not surprised if you say the cervical and lumbar curvatures, they are secondary curvatures, because they were not present earlier in life. We only add one curvature. And so the thoracic part and the sacral part, they are primary curvatures. Why? Because they were present earlier in life, so they were primary curvatures. Are you surprised that the primary curvature, it is the primary curvatures, which means the thoracic and the sacral are concave? No, you're not surprised, because they are concave anterior. And so this is opposite to the secondary curvatures, because the secondary curvatures, they are convex anterior. So these concave curvatures of the vertebral column, we call them the kyphosis, or the normal kyphosis. So we have the thoracic kyphosis and the sacral kyphosis. And the primary ones, the cervical and the lumbar, we call them the lordosis. So we have the cervical lordosis and the lumbar lordosis. Cervical lordosis and lumbar lordosis. As you can see, these curvatures, they are slightly curved. They are not like obviously exaggerated curvatures. So what happens if someone has got exaggerated curvatures? For example, see here, this was supposed to be a normal thoracic kyphosis, but this one is exaggerated one. So they have their own math, they have their own angles, like this curvature should not exceed how many degrees and all that. So we have conditions like kyphosis, which is abnormal. So note that the word kyphosis, we can have the normal kyphosis, like the anatomical kyphosis, but we can have clinical pathological kyphosis. So we use the same terminology. So kyphosis can mean the normal one, or can mean the abnormal, depending on the context on which they are talking about. Okay, so the abnormal kyphosis is exaggerated kyphosis, exceeding about 40 degrees, I guess, but I'm not sure about the maths. So this is a kyphosis, exaggerated. So it can happen also during puberty, in conditions like in situations like poor posture, but situations like TB of the spine. So it can result also into kyphosis. So that is kyphosis abnormal, and then we also have abnormal lordosis. So we have abnormal lordosis. Depending now, how do you differentiate the normal one and the abnormal in the statement? Depending on the context of the statement, on what they are talking about. You see, okay, they are talking about the normal kyphosis, normal lordosis, or they are talking about the pathological one, or the abnormal one. So this is the abnormal lordosis of the lumbar. Most of times it happens in lumbar, and you can see these exaggerated curvatures, convex anterior. It can happen in situations like pregnancy, because it is related to it is pulled anteriorly, and also in situation like obesity, where someone has got a very huge tummy, it can result into lumbar lordosis. I'm sure you have seen people like that, like this, because they have like these exaggerated curvatures. Alright, so what are the function of the vertebral column? So number one, the protective function. You are not surprised, because deep within the vertebral column passes the spinal cord. So it does the protective function, which is easy for you to understand. Why? Because the spinal cord passes within the vertebral column. But supportive function, it supports, so this is the vertebral column, it supports the head. You are not surprised, right? But at the thoracic region, so the cervical one supports the head. The thoracic vertebra, they supports the ribs, so they give attachment to the ribs, so they support the thoracic cage and the whole of the thorax region. But at the lumbar region here, they support the framework for the abdomen. So the abdominal framework is made up by this lumbar vertebra. But the sacral one, they connect they connect with the lower limbs, so the pelvic girdle, they make the pelvic girdle, and so this pelvic girdle, the pelvic girdle now helps you to transmit the weight from the upper part of the body to the lower part of the body. So it also acts as the central axis of weight bearing, of the weight bearing, and then it transmits this weight into the lower limb, so that the whole body is acting as a whole. Alright, so it also acts as site for muscular attachment. We see they'll have the muscles of the back that we have discussed, but we'll have deep muscles of the back. We have the muscles that we call the axial appendicular muscles that are coming from the exoskeleton, and some of them they are attaching directly from the vertebral column. But the vertebral column is also unique because it allows movement. So because it has got unique joints, so it allows movements like bending, turning, and rotating. All of these are made possible by the vertebral column. So what are the movements of the vertebral column? So we have flexion, bending anteriorly. The flexion, bending posteriorly is extension. But pay much attention that because we have 5 pairs of vertebral, five regions of the vertebra. So we can have a flexion, for example, of the cervical region only, but we can have a flexion of the lumbar. So the lumbar and the cervical region, they are utilizing flexion. It is difficult to flex the trunk. It's difficult to flex the thoracic vertebra because it is attached to ribs, so it's hard for it to flex. But it is easy to flex. The cervical part and the lumbar. So if someone is bending, you see, it has the lumbar region because it was supposed to be convex anterior, but now you see it's almost concave because of bending. Same applies here. You see what bends is either the lumbar, either the cervical part or the lumbar part, which are bending. Okay, so we have flexion and extension. This is extension. This is flexion, and then we have the lateral flexion. Same applies. The parts which are flexing easily, lateral, flexing by sides. So the parts which are flexing easily is the cervical region and the lumbar region. The thorax is difficult because of attachment of ribs, and so also we can have rotational movement. Okay, so let's now discuss the parts of the typical vertebra. So the vertebral column, the vertebral column is made up of different vertebrae. We have seen the cervical, thoracic, lumbar, sacral, and coccygeal. But they have something in common so that we can learn them together. So they are very different in terms of structure and what they do, but also they have something in common that can be discussed generally. So generally, we expect that the typical vertebra, the bone, typical vertebra should have the body, 7 processes, and vertebral arch. So the vertebral body, 7 processes, and the vertebral arch. So let's now discuss we start with the body. I'm gonna put this here for a reminder. So this is the vertebral body, and the vertebral body forms the anterior mass of the vertebra, and it is the weight-bearing part of the vertebra. So if this is this is the vertebral column, and this anterior is what is the vertebral body. So the vertebral body forms anterior mass-like region of the vertebra, and it is the weight-bearing part of the vertebra. So adjacent vertebral bones, the vertebral bodies are arranged on top of one another, and they are being interconnected by the intervertebral disc. Intervertebral disc. So that on top of every vertebral column is the intervertebral disc, and then we'll have another vertebral column, and then the cycle continues in that fashion. The cycle continues in that fashion. They also have on anteriorly and posteriorly, they have nutrients foramina. The small foramen, for passage of nutrients in the blood supply. Okay, so we have said we have a body, 7 processes, and the vertebral arch. So let's go to the processes. So we have 7 processes, and out of these 7 processes, 4 of them, they are articular processes. Articular processes meaning that they have ability to articulate, to form joints. So what are these? So out of these 4, 2 are superior articular processes and 2 are inferior articular processes. These are the 2 superior articular processes, and these are the 2 inferior articular processes. So each vertebra has got 2 superior articular processes, one on the right, one on the left. Same applies 2 inferior articular processes, one on the right, one on the left, as they are seen. So assume I'm talking about this vertebra, the superior articular processes, they've got articular facet. This is the articular facet, and this is articular facet, and this is articular facet, but it is on the process. So assuming I'm talking about this vertebra, so this vertebra, the superior articular processes of this vertebra, they articulate with the inferior articular processes of the vertebra above. But the inferior articular processes of this vertebra, they articulate with the superior articular processes of the vertebral body of the vertebra below. Okay? Yeah, so this is to say the superior articular processes will articulate with inferior articular processes of the adjacent vertebra, the vertebra below it, and the inferior articular processes will articulate with superior articular processes of the bone below. These superior articular processes will articulate with the inferior articular process of the bone above, above the tibia. Yeah, so they form a joint which is the zygapophyseal joint. A zygapophyseal joint, it is the synovial joint, but to be specific, it is a plain synovial joint. Plain synovial joint. We said the other time that the plain joint, they are metaxial, so they allow movement in almost 3 dimension, but in a flat surface. It's not curved as in ball and socket, but it is also metaxial. We had 7 processes. We have seen 4 processes, so we've made with 3 processes. What are these 3 processes? We have the process just behind the vertebra, which is known the spinous process. The spinous process is what you can feel when you touch at your back. So you feel you have like a furrow at the furrow at the back of your back, and then you can feel the bony prominences. Those prominences are the spinous processes of the vertebra. So they are pointing backward. And then you have 2 transverse processes, one on the right, one on the left. They are pointing in a transverse direction. It's a little bit posteriorly, posterolateral, and these are the transverse processes. So we have seen a total of 7 processes, a body, and 7 processes. Let's now talk about the vertebral arch. So this is what we call the vertebral arch here. This is the vertebral arch. So the vertebral arch, together with the posterior surface of the vertebral body, they form a foramen here, and this foramen, we call it vertebral foramen. So the vertebral foramen of one bone, of one vertebra, will join the vertebral foramen of another vertebra and another, so that they form something like a tunnel, something like a canal. And this canal is what we call the spinal canal. You can see this was one vertebral foramen, another vertebral foramen, and another. So they form a canal, and this canal we call the spinal canal or the vertebral canal. Spinal canal or the vertebral canal. What passes in the spinal canal is the spinal cord. So you should write this down. that the spinal cord passes in the spinal canal, and the spinal canal is made up of individual vertebral foramen. So the vertebral foramen, they form a canal together, and that's where the spinal cord will pass. The diameter of the vertebral canal is not uniform. There are some points where we have dilatation of the spinal canal, for example at the cervical region and the lumbar region. We're going to discuss later, because we also have the dilatation of the spinal cord at those regions. We have the spinal enlargement of the spinal cord at the cervical region and the lumbar region, and so we have dilatation also of the vertebral canal. So tell me, what happens if we have a stenosis, like narrowing of the vertebral foramen? What happens if we have a narrowing of the vertebral foramen? Of course, it's easy, because narrowing of the vertebral foramen will compress the spinal cord. Someone who have symptoms of compression of the spinal cord, so can be paralysis, like weakness, it can be pain, it can be loss of sensation, and some other, as we shall discuss them sometimes later when we're doing the spinal cord. Okay, so because we know that the spinal cord passes in the spinal foramen or spinal canal. Okay, so what is really vertebral arch? The vertebral arch is made up of these bones. So we have bilateral pedicles. So we have pedicle on this side and the pedicle on this side, and then we have bilateral lamina. So together, the pedicle, lamina, pedicle, they form a semicircle, which is now what we call the vertebral arch. This is what we call the vertebral arch. So this is the lamina, which is posterior. So in situation like stenosis of the vertebral foramen, we have said the spinal cord is compressed in this situation. So what do usually orthopedic surgeons and the neurosurgeons do? They usually cut through the lamina. So they cut through the lamina to decompress the spinal cord. So this situation, this process of cutting through the lamina is known as the laminectomy. Laminectomy means removing the lamina. Ectomy means removal. So the laminectomy is purposefully done to decompress. So they are removing either part of the lamina or the whole lamina, so as to decompress the spinal cord. All right. So between when you align two vertebra side by side, on top of one another, and then you take a look from one side, you see that they leave a gap. So they leave a gap. This gap is what we call the intervertebral foramen. But if they are two, in plural, we call them intervertebral foramina, because inter means between and foramen means hole. So this is the hole between two vertebra. So we call them the intervertebral foramina. If this is the spinal cord, it just got the branches, we call them spinal nerve. So the spinal nerve will pass through the intervertebral foramina. What passes in the intervertebral foramina is actually the spinal nerves. The spinal nerves are passing through the intervertebral foramina. So I wanted you to differentiate these two terminology, because the intervertebral foramen is not the same as the vertebral foramen, and we get it wrong in your exam if you mean the intervertebral by putting the vertebral foramen. Okay, so because the intervertebral is for passing of the spinal nerve, but the vertebral foramen is for passage of the spinal cord. The intervertebral foramen is also known as the it's also known as the neuroforamen. The neuroforamen or neuroforamina if you are talking about the plural thing. Again, if you have a stenosis of the intervertebral foramen, what will be compressed is actually the spinal nerve and not the spinal cord. Spinal nerve and not a spinal cord. Okay, so stenosis means narrowing. So if you have narrowing of the intervertebral foramen or foramina, you have symptoms for compression of nerves and not the spinal cord. There are two different things, and we shall discuss them sometimes later. But I think you already know that the spinal nerve is not the same as the spinal cord. All right, so we also have a disc between one vertebra and another, because we have said between the two vertebral bodies, there is a disc, and this disc we call it the intervertebral disc, because the word inter means between. So disc, vertebra, so this is the disc between two vertebral vertebral bodies. So they start from the vertebral body number 2 all the way to the lumbar, to the sacral here. They have been connected, like maybe they've been intervened by the vertebral disc. The vertebral disc, it accounts for 25% of the height of the vertebral column, and the main function of this intervertebral disc is to act as a shock absorber. So the shock absorbing ability of the spinal or the vertebral column is, number 1, contributed by the intervertebral disc, by number 2 by the curvatures of the vertebral column. The curvature of the vertebral column, because they act as a spring. Something to note here, that the intervertebral disc, they are vascular. They do not have blood supply, so they rely on the blood supply from the bodies of the vertebra, the vertebral bodies. Exercise like yoga and stretching, they help to decompress. They help to decompress, to enlong the vertebral column, and so they decompress the intervertebral disc. The intervertebral disc is made up of it has two important parts. The first part is this ring outside, the outside ring, which is known as the annulus fibrosus, which means that the fibrous ring. Annulus means ring, fibrosus means a fibrous. So we have a fibrous ring. This is the fibrous ring of the intervertebral disc. So it's fibrous in nature, and then it has got the nucleus. Something like a nucleus, something mucoid, like fluid like nucleus here, and it is called the nucleus pulposus. So it is basically made of two parts, and the outermost part is the annulus fibrosus, which is hard, it's a cartilage. It is a fibro cartilage, and then the inner inside, it is covered, the mucoid stuff, it is known as the nucleus pulposus. With age, this nucleus pulposus can be replaced with bones, with cartilage and so it changes. And the intervertebral disc, they account for diurnal variation in height, so that when you wake up in the morning, you're a bit taller in the morning, and you are shorter in the evening. I will put the video link below, because I've already discussed this diurnal variation and all the calculations, and I hope you can just find it. You can just watch it and see the maths. How does it change the body height between the different times of the day. All right, so the intervertebral disc, sometimes the outermost ring can be torn, and so that the inner nucleus pulposus can leak out. So we call this condition the disc herniation, in which now the nucleus pulposus can compress nerves, and then we can have symptoms of nerve compression, symptoms like pain, numbness, weakness, and decreased reflex. And most of the time it occurs in the lumbar and cervical and lumbar region, and we know in the lumbar region because the lumbar bears a significant amount of weight compared to the upper part of the vertebra. So this can be, it is very common in individuals due to sometimes age, or sometimes due to heavy lifting. So you can have herniation of disc. We also have another important relationship that I forgot to mention earlier, is that as you are moving downward, as you are moving down the vertebral column, the size of the vertebra increases. Why? Because as you're moving down, the weight bearing capacity of the bone or the vertebral column increases. Why? Now see, let's make sense out of it. The cervical region, of the vertebral column, it only supports the neck, the head, right? It only supports the neck, so it's small because it supports only the neck. But the thoracic region, it supports the chest and the neck, the chest, the neck, and the head. Okay, and then as you're moving down as well, the lumbar region, it will support the lumbar region, which is the stomach, the abdominal region. It will support the thoracic region. It will support the neck and the head. So as you're moving downside, the size of the vertebra increases because the weight bearing ability of this vertebra, they also increase. So lastly, let's now talk about the joints. Of the vertebra, So the vertebral column is forming joints with the bones of the head, which is known as the cranium. So we have the craniovertebral joints. We are not going to discuss the craniovertebral joints today, but it has the bones of the vertebral column also. They make joints with the ribs at the thoracic region. So we have the costal vertebral joint. The joint between costal means ribs and the vertebral means the vertebra. And then we have the sacroiliac joint. Is a joint between the sacral component of the vertebral column and the iliac bones. We're not going to discuss about this as well today. And then last, we have the joints within the vertebral column. So the joint within the vertebral column, we divide them into joint of the vertebral bodies, and the joint of the vertebral arches. Joint of the vertebral arches, and this is what we're going to discuss today. This one will be covered separately sometimes later when I do the bones of the neck, of the head, and some other regions. Okay, so let's now start with the joints of the vertebral arches. So these are the vertebral. You remember the vertebral arches, anything posterior from the pedicles. So anything from pedicle, the lamina, and the spinal processes. That are forming the vertebral arch. We have said the vertebral arches. We have the superior articular processes with the articular facets, and the articulating with the inferior articular processes with the of the adjacent vertebra. And we said this joint is zygapophyseal. They are called the zygapophyseal joint, but it is a synovial joint to be specific. They are plain synovial joint. So they have different arrangement on different parts of the vertebra. At the cervical region, they are oriented obliquely, and so they help in movements like flexion, extension, rotation. But at the thoracic region, they are oriented in coronal plane, so they help mainly in rotation, because we have seen in the thoracic region, the flexion and extension is limited because of the presence of ribs, right? So the joints at that region, they are mainly oriented in coronal orientation to allow rotational movement. And lastly, at lumbar, they are oriented in the sagittal plane, and so they help in flexion, extension, and it limits rotation. So mainly rotation occurs at the upper part, at the thoracic region, but flexion extension occurs mainly at the lumbar and the cervical region. So these are the joints of the vertebral arches, as we have already discussed. And then we have the joints of the vertebral bodies. The joint of the vertebral bodies, you see between one vertebral body and another we have a joint, and this joint is actually cartilaginous joint. Which kind of cartilaginous joint? It is the secondary cartilaginous joint, and the secondary cartilaginous joint, we call them symphysis. But to be specific, what kind of symphysis? We said that it is a wide symphysis. Remember the discussion on elements of arthrology. And so what is the cartilage here? What is the name of the cartilage? That is fibrocartilage, to differentiate it from the hyaline cartilage that we have already discussed. So this is the intervertebral disc, and it's actually what contributes this intervertebral joint, the joint of the vertebral body. And then we have a joint between the first cervical vertebra and the second cervical vertebra. This joint is special. is different from the joints of other vertebral bodies. Is different because this joint, it is a synovial joint, but to be specific, it is the pivot synovial joint. Why? Because it's a joint between one bone and the cylindrical end of another bone. So you see, we have this the second vertebra. The second vertebra is known as the axis. The second cervical vertebra is known as the axis, but the first is cervical vertebra is known as the atras. So we have an atras and axis. We discuss them later when we are doing the bones of the neck. But you should know at this point that this is an atras, this is an axis, and so they are forming a joint. The dens of an axis, it rotates against the cylindrical end of an atras, and this joint, we discussed it. We said the joint like this, we call them the pivot joint, but it's actually under the synovial group. So it's a synovial pivot or pivot joint. This joint is known as atlantoaxial joint. The name of the joint actually, the atlantoaxial, because it's between the atras and axis. So this is atras and this is axis. Why are they called axis and atras? We don't know at this point, but see you later when you're discussing the bones of the neck. We're gonna make every sense of what's happening in that joint and of these bones. All right, guys, it was nice discussing this vertebral column with you, and I hope, as always, if you have question, addition, comment, you can always put your thoughts in the comment section. I read every comment, but I will put the video link for the the validation of the height, and so make sure you have watched it, and then stay tuned, subscribe and stay tuned, because we're going to have a series of discussion in a near future, very soon. You can always swing by the TikTok and the Instagram. I regularly post there the different mnemonics and quiz and questions. So see you very soon. All right.